eye bags, dark circle under the eyes, and under eye hollowness. These problems are very frequently encountered in Indian population, and I do get many queries regarding to these issues, and the answer to these problems is a filler. So in today's video we'll be discussing under eye fillers, and I'll tell you everything in detail about under eye fillers. For whom it is, for whom it is not, how much quantity is to be used, how painful it is, how much time it takes, how much time it will last, and everything related to under eye fillers we'll discuss in this video. Hello friends, I am Dr. Ankit Gupta and I practice in Pitampura, New Delhi. And today we are doing under eye fillers. So under eye fillers is mainly for filling up the area which is just under the eye, as you can decipher from the word under eye fillers. So you need to differentiate between what a Botox is and what a filler is. Most of the patients get confused between Botox and filler. Botox is a neurotoxin which is given in the upper area of the head for crow's feet and for the 11s to numb the muscles so as the wrinkles disappear. Whereas a filler is to fill up a depression. The most common conditions for which I use filler in my practice for the under eye area are: number 1, camouflaging a very light or mild eye bags. So it is not for somebody who has very huge eye bags, but for somebody who has just started having eye bags or who have very mild eye bags, or somebody who has moderate eye bags but they cannot afford the downtime of a surgery, or if they do not want to undergo a surgery for them. So we can just fill the depression which is just underneath the eye bag so as to camouflage the eye bag. So it is not actually treating the eye bags, it is camouflaging it with a filler just given below the eye bags. So that is one condition. Again, it can be done for somebody who has a hollowness under the eyes. And similarly, if somebody has dark circles which is caused because of hollowness, only in those patients filler would help. In somebody who does not have hollowness, has only dark skin in them, a filler would not actually help. But there's a different kind of filler which is used for hydration of the skin that can be used. And similarly, for fine wrinkles under the eye, a hydrating kind of a filler can be used. But the most commonly done fillers that I do are for camouflaging the eye bags, for filling up the depressions, and for dark circles. Very important question that patients ask me or they want to know is how much filler would be used in their case. So I need to assess you for that. But usually if I have to do only your under eyes, usually 1 ml of filler is sufficient for both the eyes, until and unless you don't have very huge eye bags which I have to camouflage, or if you don't have a lot of depression in this area. Ideally, one should always get their cheeks filled first using a thicker filler, and then they should get their under eyes done, because when you fill up the cheeks, the depressions they get filled up because the tissue moves up and this hollowness and the eye bags, they become less visible. But I do understand, because of money constraints, not everybody can afford getting their cheek filler done, and many times the only concern is the under eye area. In those patients, only 1 ml of filler is sufficient. That can camouflage to some extent the eye bags and can fill up your depressions. So today I'll be showing you a patient in which we have used 1 ml of filler, and this filler I have used is Restylane, and for her I'll show you how we do it. So in her case, we have just filled up under the eye over here and in the tear trough area, and the tear trough filler that we have done, as you can appreciate, on the right side we have already completed our fillers now, and on the left side we have not done it, and you can see a lot of difference that you can see immediately after the filler is done. So the most important advantage of filler compared to a surgery is that you can get it done within 5 minutes. These are just injections. You just have to point the area where you need the filler, and then in that area we can fill up the area and the depression will immediately go away. And if you have used the correct filler, it won't show, it won't swell up too much, there will be no Tyndall effect, that is blue coloration, which you might get if you use the wrong filler, and if done properly in proper hands, there is absolutely no complications. Another question that patients ask me is, what filler would I use? What is the cost of the filler? So the cost will depend on what filler is being done. Okay, so a filler is not like a single injection that the cost would be fixed. There are 10 to 15 different kinds of filler that are available in the market, and every company makes different fillers of different quality and different thickness. For the under eye area, since the skin is very thin, we need a filler which is very liquidy, which is very soft, and since the skin is very thin, we do not want something that is very thick. Otherwise, when the light falls, it can cause Tyndall effect, because of which there can be bluish coloration which can be seen. Since the skin is so thin, we need something which is similar to your skin color only. So What I prefer is Volbella from the Allergan company and Restylane from the Galderma company. This is my preference, and many other doctors would have a different preference, but these are the thin fillers which are most commonly done for under eye area and for the lips. Another important concern is that how long will these fillers last? Are they for life? No, fillers are not for life, and that is the good and the bad part about the fillers. If you like it, even then they will go away within about 9 months. If you don't like it, they will go away in 9 months. But the important thing is that if in case you don't like it, or if there is some lumpy bumpy thing, or if the surface is not regular, there is an option of dissolving the fillers, and using hyaluronidase you can immediately dissolve these hyaluronic acid fillers. So to sum up, the fillers usually last for about 9 months, but for some they may last for about a year or so. Another question that I usually get is that do we have to repeat it? So no, if you want to, you can always repeat it when the fillers disappear, because the body will dissolve this filler on its own, because hyaluronic acid fillers, they are of the similar component which our body cells are. So the ground substance of our body is hyaluronic acid, and these hyaluronic acid fillers, they get absorbed by our body in about 9 months to a year. If you like it, you can get it repeated after 9 months to a year. If you don't like it, you may not get it done. So it won't really cause any harm or any other problems to your body. Coming to the side effects or the bad things about filler. So the side effects are very few. It can cause a little bit of bump, which with massage can easily go. It can cause a little bit of bruising. Since we are injecting the filler into your skin, there can be a little bit of bruise if by chance any blood vessel is pricked. Very rarely, if the filler migrates, it can cause a deformity or a disfiguration, which you can easily get dissolved with a hyaluronidase injection. And otherwise, this is a very safe filler. If you get a thicker filler done, or done by somebody who is not very trained, or if by mistake the filler is filled very superficial, then you can have bluish discoloration or Tyndall effect. If the filler is by mistake filled in this area, it can cause swelling in this area, which can last for a bit longer. But anybody who is doing fillers very regularly knows all this and will take care that you don't face such issues. Now coming to the last thing, what are the alternatives? If you don't like fillers, or if you have already had fillers and you were not happy with it and you want something different, the other options are, if you have eye bags, you can always opt for a transconjunctival blepharoplasty, and I have shared a lot of videos. I have made a lot of videos on transconjunctival blepharoplasties, and you can go through them. If you have eye bags which are moderate, you should go for a transconjunctival blepharoplasty. The other alternative of a filler is fat grafting. If you have depression in this area, we can always take out fat from your tummy, process it into micro and nano fat. We have made separate videos on fat grafting, and those fat cells are your own body fat cells which are natural. We can fill in the under eye area, which act as natural fillers. Now you would ask that why don't we do fat grafting for every patient? Because fat grafting takes a longer time. It causes a lot of bruising and swelling. It takes much longer to heal. Whereas in a filler, it takes hardly 10 to 15 minutes. It's a lunchtime procedure. You can come down, get it done, walk out of the office and join back your office. It's like going to a parlor or something. There is absolutely no visible marks on your face. If you have a party, you can just get your filler done today and go to the party tomorrow. If you cannot have downtime, filler is a good option. If you can have a downtime, fat grafting is a good option. What to do if some filler is remaining? So if in case we have opened 1 ml vial of filler for you, and 0.2 ml remains and only 0.8 was used, the same filler you can get done for your lips. Whatever remains, it is the same filler that people use for lips. And if you would like a subtle change in your upper lip or your lower lip, you can use the same filler for your lip as well. So this was all about under eye fillers. If you have such issues, you can always contact our team on 9599554211 and we'll be happy to help you. Thank you very much.